Good morning, everyone. Thank you all for joining our virtual news conference. I'm Dr. Bill Schaffner. I'm the Medical Director of the National Foundation for Infectious Diseases, the NFID. On behalf of NFID, I'm very pleased to welcome you this morning to talk about influenza, the flu, as well as pneumococcal disease. Before we begin, I do want to remind those of you on social media to please join the conversation by using the hashtags #FightFlu and PreventPneumo. NFID has been hosting this important event for nearly 25 years. For those of you who have joined us in the past, our news conference does look a little different this year. After all, we're speaking to you via Zoom, but our message remains the same and the urgency around it is greater than ever this year. The most important message you will hear today is this: get your annual flu vaccine now. The recommendation is simple. It applies to everyone aged 6 months and older, and it's critically important for those at high risk for flu-related complications, such as very young children, pregnant women, older adults, and people with certain chronic underlying health conditions. We in the infectious disease community have been talking about a potentially double barrel of respiratory virus season when flu and COVID-19 converge. There's a real risk that even if we only have a moderate flu season, we could be in for a rough few months ahead. So now more than ever, the mission of NFID to educate the public and healthcare professionals about the prevention and treatment of infectious diseases across the lifespan. It's vital to the public health. We're pleased to bring together government, nonprofit, and private sector organizations, along with professional societies and other partners, to collectively advocate for flu and pneumococcal disease prevention with one strong voice. Thank you to members of the media who communicate these important messages to the public. I'm pleased to welcome our keynote speaker and someone that we've all come to know very well, Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases. It's an honor to have Dr. Fauci join us today. Our other distinguished panelists include Dr. Federico Asch, who is Director of the Echocardiography Core Lab at MedStar Health Research Institute and Associate Professor of Medicine at Georgetown University. Dr. Asch will talk about protecting older adults and those with chronic health conditions from flu and pneumococcal disease. I'd also like to welcome NFID President Dr. Patricia Whitley-Williams, who is Professor of Pediatrics and Associate Dean for Inclusion and Diversity at Rutgers Robert Wood Johnson Medical School. She joins us today to talk about preventing flu in children and also addressing the challenges associated with health disparities. Now, following the presentations, we'll hold a Q&A session for credentialed members of the media. Dr. Dan Jernigan, Director of the Influenza Division at the Centers for Disease Control and Prevention, will join us to answer questions regarding the CDC data that will be shared today. Members of the media may submit questions at any time via the box below the webcast video on your screen. Please be sure, include your name and the media outlet you represent. All questions will be held until the end of the presentations. Now, permit me to share just a few remarks. Influenza viruses circulate every year, and flu has an enormous impact on our society. So why is it that flu vaccine coverage in this country is so low year after year? CDC estimates that only 48% of US adults were vaccinated against flu during the last 2019-2020 season. As we look to the months ahead, the scary reality is that we could face a twindemic of COVID-19 and influenza circulating simultaneously. The two viruses share similar symptoms. people with COVID-19 may assume they have the flu, and vice versa. It will be hard for physicians and other healthcare providers to tell the difference between the diseases based on symptoms alone, and testing may be necessary to help confirm a diagnosis, and even testing has its limitations and challenges. Additionally, many of the same people who are most vulnerable to serious complications of COVID-19, including older adults and those with chronic health conditions, are also at greater risk for complications from flu. Long-term complications of both COVID-19 and flu include a higher risk for heart attack and stroke, and there's still much to learn about COVID-19. Healthcare facilities and personnel could be stretched to their limits. Flu is the respiratory virus that we can actually do something about. We need to prioritize flu prevention and treatment. If everyone 6 months of age and older would get vaccinated against flu, we can save lives and reduce the burden on the healthcare system. Is the flu vaccine perfect? Of course not. We know that. Flu vaccine effectiveness can vary from season to season among different age and risk groups. But it's important, very important, that people understand that flu vaccines help prevent tens of thousands of hospitalizations each year and other serious complications such as heart attack and stroke. Even if you do get flu, despite getting vaccinated, please hear this. You are likely to benefit by having a less severe and shorter illness. And you are far less likely to get pneumonia. You're less likely to be hospitalized, and you're less likely to die. Hello, what's wrong with that? This year, NFID again commissioned a survey of US adults to better understand beliefs around influenza and pneumococcal disease, especially in the context of COVID-19 pandemic. What we found is both hopeful and also concerning. Here are some things that we found. 68% of US adults think that flu vaccination is the best preventive measure against flu-related death and hospitalization. That's great, because it's true. And 28% say that the COVID-19 pandemic makes them more likely to get vaccinated against flu during the 2021 season, this season. However, despite this acknowledgement of vaccination as the best preventive measure and increased intent to get vaccinated with flu vaccine, only 59% of adults said they plan to get vaccinated against flu this season. This does represent a slight increase from the survey we commissioned last year, but we still have a very long way to go. Also of concern, and it's a major concern, the survey showed that more than half, 62%, of Black adults either are not sure or do not plan to get vaccinated against flu, a disparity in protection, which is a real problem that we must address. And among US adults who are at higher risk for flu-related complications, including adults aged 65 years and older, and those with diabetes, heart disease, or asthma, the survey found that nearly 1 in 4 were not planning to get vaccinated this flu season. 1 in 4 were not planning to get vaccinated, although they had high-risk conditions that put them at risk of severe disease. But we are making some progress. While the most cited reason for not getting a flu vaccine was still the belief, flu vaccines don't work very well, there was a significant decrease in those who believe that, from last year 51% to this year only 34%. This suggests that our messaging around the benefits of partial protection is working. We keep needing to hammer that point home. Now, if there was ever a time to get the flu vaccine, this is the year. And as healthcare professionals, we need to make sure that all of our patients are protected against flu. We also need to make sure that patients are up to date with other recommended vaccines, including pneumococcal vaccines, since pneumococcal disease can be a serious complication of the flu. According to the NFID survey, more than half, 51% of individuals at higher risk for pneumococcal disease report they have not been advised to get vaccinated against pneumococcal disease. There's a gap we need to fill. Flu and pneumococcal vaccines can be co-administered at the same visit. So now's the time to talk with your healthcare professional about whether you need pneumococcal vaccine. So, in addition to getting vaccinated, please remember to take other recommended precautions, including staying 6 feet apart, wearing a mask when you go out in public. That all said, it's now my great pleasure to introduce our keynote speaker today, Dr. Anthony Fauci. Tony?
Bill, thank you very much. I appreciate your introduction, and I enjoy being here with you. You made some extraordinary important points, Bill, that I'm going to underscore a bit during this brief slide presentation. So as you can see from this first slide, I'm going to talk about many of the things that Bill emphasized, namely the importance of flu and pneumococcal disease and vaccine to prevent both. So let's take a look, first of all, to put it into perspective. The annual burden of influenza globally and in the United States, these are not insignificant numbers. Each year in the United States, there's anywhere from 12 to 61,000 deaths associated with influenza, severe cases requiring hospitalization, depending upon how bad the year is measured in hundreds of thousands, and cases are measured in the tens of millions. This is extrapolated globally. The same thing, the rest of the world is not any more immune to this than we are. It's a global disease seasonally that occurs every single year. Associated with it is an important economic burden. The average annual total economic burden of the flu to the healthcare system is over $10 billion. So there's a good reason for yourself, for your own health, but also for the economy of the country to avoid getting infected. Let's take a look at just last year, the 2019-2020 seasonal flu. There were about 20,000 deaths, over 350, 400,000 hospitalization, millions of medical visits, and tens of millions of illnesses. Now, to underscore what Bill said so well, how do you prevent and treat the flu? First of all, again and again, get vaccinated. Take everyday preventive actions to stop the spread of germs. And as we'll hear, and as we've been talking about now for months, the very type of preventive actions that stop the spread of influenza will help you to prevent getting infected or infecting someone else with COVID. And then, as we'll get to in a moment, ask your doctor about antiviral medications, because we do have good anti-flu medications. So let's take a quick look at these 3 points that I brought out. First, get vaccinated. So it's pretty clear. It's not something that's complicated. Everybody 6 months of age or older should get an annual flu vaccine. In fact, if you look at the MMWR just from a month ago, the CDC clearly recommends routine annual influenza vaccines for everyone aged 6 months of age or older who do not have inherent contraindications for the vaccine. Now, what are the benefits of the flu vaccine and the importance of partial protection? Bill emphasized this very well. So first of all, if you are vaccinated, you are less likely to get the flu. Namely, you're less likely to get infected. But people don't appreciate some of the benefits of influenza vaccine that really are very, very important. In many cases, even as important as preventing you from getting the initial infection. Even if you do get sick, flu vaccination can reduce the severity and the duration of illness, and importantly, can help to keep you out of the hospital. In addition, a secondary benefit, by getting vaccinated, you can prevent the spread of flu to those of you around you who are at greatest risk of becoming seriously ill. We always talk about infectious diseases. It's our personal responsibility to protect ourselves, but we also have a responsibility to protect the vulnerables around us, including young children, pregnant women, adults 65 years of age or older, and those with certain underlying chronic health conditions. Again, very similar to the situation that we see with the current challenge of COVID. The benefits of the flu vaccination, as was mentioned, about 52% of people 6 months and older in the United States were vaccinated during the 2019-2020 flu season. The CDC estimates that flu vaccine actually prevented 7.5 million illnesses, 3.7 million medical visits, over 100,000 flu hospitalization, and over 6,000 flu deaths. Now, the second point that I made, take everyday preventive actions to stop the spread of germs. As Bill mentioned, and I'll underscore it, avoid close contact with sick people, avoid touching your eyes, nose, mouth, cover your coughs, wash your hands. Next, ask your doctor about antiviral medications. If you are sick with the flu, we have drugs that can be used to treat your illness. There are 4 FDA-approved antiviral drugs which are recommended by the CDC for the 2020-2021 influenza season that we are about to enter. In fact, in many respects, we're already there. Oseltamivir phosphate, often referred to as Tamiflu, zanamivir, referred to as Relenza, peramivir, Rapivab, and baloxavir, which is the newest of these that has just been shown actually to be effective. Now, antiviral treatment works best when started within 2 days of getting symptoms, but you can also take it beyond the 2 days. The reason we bring this out today is that particularly if you are a person who's vulnerable, an elderly individual, someone with an underlying disease, and you suspect that you have the flu, it is important to contact your physician about the possibility of getting one of these antiviral drugs. Let me just spend a minute on COVID in the United States. As you well know, everyone knows, we are in the middle of a historic pandemic that severely is involving the United States of America as the country which is the most severely hit, with over 7 million cases. And as of yesterday, there are 205,000 deaths. Truly a transforming pandemic of historic nature. And we're not through with it yet. In fact, there's considerable concern as we enter the fall and the winter months and into the flu season that will have that dreaded overlap of 2 respiratory-borne diseases, namely influenza and COVID-19. And for that reason, it's so important of what Bill has said to you and what I'm underscoring right now about the ability which we have of clearly medically avoiding at least one of those, and by public health measures, both of those. So, flu or COVID-19, it really is a diagnostic challenge because there are shared signs and symptoms. We refer to it commonly as a flu-like symptoms: fever, feverish chills, cough, perhaps shortness of breath, fatigue, sore throat, running or stuffy nose, body aches, headache, and maybe even some GI symptoms, particularly among children, with vomiting and diarrhea. Now, steps to fight the flu and COVID-19 overlap greatly. We don't want those 2 diseases together, but some of the good news is that the commonly practiced public health measures are good for both of these. Wear a mask, cloth face covering in public. Maintain your physical distance, avoiding crowds. Outdoors, always better than indoors where possible. Wash hands frequently. Avoid touching your eyes, nose, mouth. Clean and disinfect frequently and touch surfaces. And stay home when you are sick. Important. If diagnosed with the flu and you know it's the flu, take flu antiviral medications. And again, let me underscore what Bill and I have been saying. Get a flu vaccine to protect yourselves, your loved ones, and your community. I might mention one thing that's really important is that, as many of you know, the Southern Hemisphere has their influenza season from April to the end of August, when essentially we have our summer. So they've been through their flu season. And because the Australians in the Southern Hemisphere did so many of the things on this slide, they had a very, very light flu season, which hopefully, together with the flu vaccine, if we do what's on this slide, we'll have the same thing. Let me just spend a couple of minutes to close on a pneumococcal disease, which Bill mentioned is very important. This is caused by Streptococcus pneumoniae bacteria. It causes a number of different types of infectious disease manifestations: pneumonia, ear infections, sinus infections, meningitis, and the dreaded bacteremia, or a bloodstream infection. It causes about 150,000 hospitalizations each year in the United States, and 5 to 7% of those who are hospitalized with it will die. This is a serious disease, particularly for the elderly, those aged 65 years of age and over. And you know, the flu season is a terrific time to make sure that you check with your physician, that you're up to date on pneumococcal vaccines. There are 2 vaccines in the United States that help protect against pneumococcal disease: the pneumococcal conjugate PCV13 and the pneumococcal polysaccharide vaccine, the PPSV23. Now, the CDC recommends the PCV13 for all children younger than 2, for people 2 years of age or older with certain medical conditions, and in addition, adults 65 years of age or older may discuss with their clinician to receive the PCV13. However, the recommendation of the CDC for the PPSV23 is all adults 65 years of age or older. That's me. Bill is probably not that old, but that's me. People 2 through 64 years old with certain medical conditions, and adults 19 through 64 years old, particularly those who smoke cigarettes. So if you're a young person and you smoke, which you should not be doing in the first place, you should get a pneumococcal PPSV23 vaccine. And in closing, again, let me emphasize this: get yourself and your family vaccinated. I was vaccinated 2 days ago. I feel great. I'm glad I did it. Hopefully it will protect me and my family. Thank you, Bill. I'll stop there.
Tony, that's wonderful. I love your messages. I'd now like to transition and introduce Dr. Federico Asch to speak about influenza in older adults and those with, indeed, those chronic health conditions we've been talking about. Federico?
Thank you, and good morning, everyone. As Dr. Schaffner mentioned, I am joining you today as a cardiologist to give you my perspective on flu and pneumococcal disease. Having worked in the cardiac intensive care unit for many years, I have seen some of the worst complications of flu, including myocarditis and inflammation of the heart muscle. Myocarditis can cause chest pain and result in heart failure and abnormal rhythms, both of which can be life-threatening. This year, I am especially worried about my patients and our community. We have the potential for a lot of additional confusion, since flu and COVID-19 are both contagious respiratory diseases, and many of the same groups are at higher risk for complications of both viral infections. In recent years, adults aged 65 years and older account for between 50 and 70% of flu-related hospitalizations. During the 2019-2020 flu season, 93% of US adults who were hospitalized for flu-related complications had at least one underlying medical condition. The most common were cardiovascular disease, diabetes, obesity, and chronic lung disease. And according to the CDC, the vaccination rate among adults aged 18 to 49 years with at least one of those chronic health conditions was only 44% during the previous flu season. Unfortunately, these combinations can place affected individuals at high risk. Flu can exacerbate underlying conditions and lead to life-threatening complications like heart attack, stroke, permanent physical decline, pneumonia, hospitalizations, and even death. Patients with diabetes and heart disease are most vulnerable and need the added protection to their immune system. We see time and again that flu can exacerbate these conditions or can even trigger an event. For example, studies have shown that adults with heart disease are at 6 times increased risk of having a heart attack within 7 days of a flu infection. The risk of flu-related hospitalizations for adults with diabetes is 6 times greater. And adults with diabetes are 3 times more likely to die of flu-related complications. That is why getting an annual flu vaccine is critical, especially among vulnerable populations. Flu vaccinations has been shown to lower rates of cardiac arrest in people with heart disease and to reduce admissions for stroke or heart failure, while reducing death rates in adults with type 2 diabetes. But those living with heart disease are not the only ones who need a flu vaccine. Among patients with respiratory disease, like asthma or COPD, we see very similar statistics. This is true even when the chronic condition is well controlled with lifestyle management and medications. For example, we know that in cases of asthma, flu increases inflammation and can increase the rates of pneumonia. Bottom line, prevention through annual flu vaccination must be a part of overall disease management for older adults and for patients with chronic health conditions. And it is just as important as it is eating a balanced diet, quitting smoking, getting more exercise, or even being compliant with the medications. The benefits of annual flu vaccination cannot be understated because we know it lowers rates of serious infection, hospitalization, cardiovascular events, and death. But here are my concerns. According to the survey, nearly 1 in 4 adults who are at high risk for flu-related complications based on age or health conditions said that they were not planning to get vaccinated against flu this season. Among this higher risk group, 46% said they were not familiar with pneumococcal disease, and more than half reported that they have not been advised to get vaccinated against pneumococcal disease. So we still have a lot of work to do to educate our community and to convince people that they need to be protected against both the flu and pneumococcal disease. I am a Latino myself, originally from Argentina. That's where I grew up and where I went to medical school. I do a lot of work to support disease prevention in the Hispanic community, and I am a strong advocate for vaccination as a way to control preventable conditions such as flu and pneumococcal pneumonia. Sadly, complications from pneumonia and influenza combined are a leading cause of death among Hispanics. And yet, adult vaccination coverage remains particularly low among Hispanics. For the 2019-2020 flu season, vaccination coverage among Hispanics adults was only 38.3%. Dr. Whitley-Williams will discuss this topic in more detail, but improving access to and acceptance of flu vaccine among communities of color and Hispanics must be part of our national strategy to prevent illness and reduce stress on the US healthcare system caused by flu and COVID-19. We, as healthcare professionals, need to insist upon annual flu vaccination for all our patients, and particularly those with chronic health conditions, older adults, Black and Hispanic patients. Annual flu vaccination is a highly effective, simple, and safe step that we can all take to help prevent flu and stay healthy. And for those representing the media, we urgently need your help to spread the word and help protect the health of our community. Thank you.
Federico, thank you very much. Your message is that something as simple and easy as flu vaccine can have such profound benefits for people with chronic illnesses is really very important. Now, next, I'll hand it over to our NFID president, Dr. Patricia Whitley-Williams, who will talk about increasing vaccination rates among children and also addressing the issue that we've been talking about regarding health disparities and the receipt of flu vaccine. Pat?
Thank you so much, Bill. Good morning. It is a pleasure for me to be here today to talk to you about preventing flu in children and addressing health disparities. 2020 has been an incredibly tough year that has changed all of our lives forever. Some of us are coping with the loss of loved ones. I know I lost 2 close friends, loss of employment, loss of income to support our families, disruption in education for our children, and less social contact with friends and family. The COVID-19 pandemic has significantly increased attention on the prevention and treatment of infectious diseases. And it has also underscored the importance of vaccination. This season, we need to do everything in our power to increase flu vaccination rates and reduce the spread of flu. I, like many of you, wear many hats, multiple hats in my personal and professional life. My remarks today will reflect that. I'm a stepmother and an aunt. I'm a pediatrician and a pediatric infectious disease specialist by training. And I am, as you heard, the president of the National Foundation for Infectious Diseases. I'm also a professor of pediatrics and the Associate Dean of Inclusion and Diversity at Rutgers Robert Wood Johnson Medical School. And I am passionate about the elimination of disparities in health outcomes. I would like to begin my comments today by calling to your attention the significant impact that flu has on children. As you have heard, we are likely to see a convergence of COVID-19, influenza, and other respiratory diseases during this 2020-2021 flu season. And all of this will happen while schools in many states are beginning to reopen. As you know, children are super spreaders of flu, as they are of other respiratory viruses, but they do pass on more of the flu virus for longer periods of time compared to adults. I still love the kids though. Kids bring home the virus, they spread it to us, they spread it to their parents, they spread it to their grandparents and neighbors and friends. No one is immune. That, coupled with the fact that COVID-19 and flu have similar symptoms, means that a surge could be devastating for both individual families and the US healthcare system at large. Healthcare professionals and parents need to do their part to stop the spread of flu at school, at home, within our families, and in our communities. To do this, annual flu vaccination is critical. While it is good news that pediatric vaccination rates against flu were 63.8% for the 2019-20 flu season, significantly higher than the adult coverage rates, which you heard were less than 40%, they are still not nearly high enough in children. The 2019-2020 flu season was actually terrible for kids. There were 188 flu-related deaths in children reported to the CDC. This matches the record set in 2017-2018 flu season for the highest number of pediatric flu deaths reported during a regular flu season. And sadly, we just learned that CDC will be reporting another pediatric death, bringing the total to 189. And another fact is that we also know that the number of pediatric flu deaths reported to the CDC each season is likely lower than the actual number. And the number of children who died from flu-related causes during the 2019-2020 season is likely a lot higher. And what is truly devastating is that more than half of these children were healthy. They had no pre-existing conditions. In children, we know that flu vaccination is critical because it can significantly reduce a child's risk of death. A recent study showed that flu vaccination reduced the risk of flu-associated deaths in children by 65% and prevented admission into a pediatric intensive care unit by 74%. To illustrate the devastating impact flu can have, I want to share with you a personal experience that I and my colleagues experienced during last flu season. 6-year-old patient several years ago received a flu vaccine, and the child developed a mild local reaction at the site of the injection. Some swelling, some redness, some tenderness. But the parents were alarmed and prevented the child from getting the flu vaccine for the next several years. And the family members did not receive flu vaccine either. Fast forward to January of 2020. Unfortunately, this child was now 9 years of age. He becomes ill with influenza, and we found out it was influenza A, and ends up being admitted to the hospital. Quickly, he developed a secondary bacterial pneumonia. And before you know it, he was in a life-threatening situation and in our pediatric intensive care unit, all because of not getting vaccinated. I can tell you this was a learning lesson for that family. All the family members did get vaccinated before that child left the hospital. Thank God that child did recover and was vaccinated. So you see, we must think about vaccination for children of all ages, not just the youngest children who are particularly susceptible to serious flu complications. The virus does not stop infecting people simply because they have turned a certain age. So school-age children, teenagers, college-age kids, they're all at risk as well. More than 100 of these deaths were in children ages 5 to 17 years of age. This is simply unacceptable. I would like to emphasize that flu vaccination, and I think this was mentioned before, is critical for pregnant women, because not only does it protect the pregnant women from flu-related illnesses and hospitalizations, but it also has been shown when you vaccinate a pregnant woman against the flu, guess what? It protects her newborn infant, and it also will protect those infants for the first several months of life. The flu vaccine is not perfect. We know that, and we've talked about that. It won't provide 100% protection against flu, but it will reduce severity and duration of disease, and it will help save children's lives. In addition to getting kids vaccinated, general wellness and prevention of illness should be a top priority for families. And this guidance applies to children of all ages, whether they're learning in the classroom or they're learning at home. So now is the perfect time, again, to focus on washing hands, staying at home when sick, avoiding touching your eyes, nose, and mouth, continuing to wear masks in public places, and social distancing when possible. Okay, I just want to switch hats and address some standing health disparities in this country. And you have heard Dr. Asch mention this as well. The COVID-19 pandemic has shed new light on health outcomes among Blacks and Hispanics. And it also has underscored the importance of addressing myths and misconceptions about vaccine safety and efficacy in communities of color. During the 2019-2020 flu season, vaccination coverage rates among non-Hispanic whites was 55%, compared to 46% in non-Hispanic Blacks and 47% in Hispanics. Additionally, non-Hispanic Black children had lower flu vaccination coverage rates than children in all other racial and ethnic groups. The NFID survey that Dr. Schaffner and Dr. Asch both discussed also found that Black adults are more worried about being infected with COVID-19 and flu at the same time, more so than their white counterparts. And this makes sense. Black adults in the US are more likely to be hospitalized and to die from COVID-19 as they are flu. However, despite this concern, nearly 62% of Black adults said they either are unsure or will not get a flu vaccine this year. This disconnect is a big concern. We do not yet have a vaccine for COVID-19. We do have a vaccine for flu. And flu vaccines have been around for more than 50 years, and hundreds of millions of individuals have been safely vaccinated. The NFID survey also found that Black adults are more likely to say that they will not take an antiviral medication for flu if recommended by a healthcare professional. Nearly 40% say that they will not take flu antiviral medications. Treatment with these antiviral medications, as you heard Dr. Fauci mention, can help reduce flu symptoms and shorten the duration of illness and prevent serious complications. Antiviral drugs are not a substitute, however, for annual flu vaccination. However, they can serve as an important additional line of defense. We know that there are multiple barriers at play here in communities of color, including, but certainly not limited to, unconscious bias, institutional racism, distrust of the healthcare system, and vaccine hesitancy. Despite these hurdles, we cannot become complacent in our attempts to drive change. Now is the time for change. Now is the time for everyone to get a flu vaccine. It's our responsibility as healthcare professionals to take time to talk to our patients about the importance of flu prevention and treatment, to engage the communities of color in addressing these vaccination coverage rate gaps, and to emphasize that we have decades of data showing that flu vaccines are safe and will not give you the flu. Flu continues to be a public health crisis for children of all ages and their families. Fortunately, it is a vaccine preventable disease. And the more people who are vaccinated, the more people who are protected. Thank you for your attention.
Thank you, Pat, for your ringing affirmation of all those messages. And I must say that as I listened to you, I thought about those 189 children who succumbed to influenza during the last influenza season. That's a number. Behind each and every number, 189 of them, is a family. Mothers, fathers, brothers, sisters, aunts, uncles, grandparents, still grieving. So many of those infections could have been prevented. Perhaps not all, but many. Others could have been made less severe. We need to think about that, and that reinforces your messages. That said, that concludes our formal presentations today. Now for the Q&A. Note that this portion of the event is reserved for questions from credentialed media only. We know that many of you may have questions about COVID-19 vaccines. However, please understand that we're here today to talk about flu and pneumococcal disease and their prevention. So thank you for focusing your questions on those topics. We appreciate that. Please submit your questions via the box below the webcast video on your screen, and be sure to include your name and the media outlet you represent when you're submitting your question. Marla Dalton, who's the Executive Director and CEO of NFID, will curate the questions, read them, and I'll direct them to our panelists. So Marla, do we already have some questions?
Bill, we do. We recently had several questions about flu vaccine shortages in certain areas of the country. Can you address this?
So I'm going to ask Dr. Daniel Jernigan here from the CDC, head of their influenza division, to address that. Dan, can you talk to us about that?
Sure, yeah, absolutely. So we have heard that there are some spot shortages that people have talked about where they've gone to a clinic and the clinic hasn't gotten their vaccine yet. So we know each year at the early part of the season, we see that there are people will come to the clinic and they aren't able to get it sometimes. And so they want to know what's going on. Right now, there is a planned 198 million doses that will be distributed this year. About 90 million of that has been distributed. Much more vaccine is planning to be distributed. And so in terms of shortages of vaccine, we don't know of any national shortage of vaccine, but there may be places where people try and go and get a vaccine where they're not able to get it now, but that doesn't mean don't give up. You should be getting your vaccine. We also know that in the past, we've recommended folks to go to vaccinefinder.org where you can put in your zip code and actually find out where they are giving vaccines around you. We understand that just in the last few days, there has been an issue with an upgrade to that site that is still ongoing. We're working with our colleagues at Harvard who manage that. And so at this point, if you go into that tool, which is listed on a lot of our sites and a lot of the NFID materials, it may say there's no flu vaccine near you. There is a phone number for each of those sites on there. So you can find the sites that do vaccination. You can call that number and find out if they have it. We've been doing that and find out they do have high dose vaccine. They do have other vaccines. And so don't let that be any reason why you don't get a vaccine right now. Give them a call and find out. That'll get fixed sometime soon. But we don't know of any national shortages now. But we do know that periodically people will not be able to find it when they want it. But that doesn't mean you shouldn't get vaccinated.
Yeah, there's plenty of time to get vaccinated. Thank you, Dan. We're a little bit a prisoner of our technology, but I'm sure that will get fixed very soon. Marla?
Sorry, so the next one comes from Eileen O'Reilly at Axios, and it's actually a double question. So the first part is, do we have any effective diagnostic tests for both flu and COVID-19? And the follow-up is, how dangerous would it be for a person to be diagnosed and treated for the wrong virus, flu versus SARS-CoV-2, particularly as people tend to do better when treated in early stages?
Good questions. Tony, why don't you take that?
Yes, there are. I mean, we certainly have diagnostic tests for influenza. They are commercially available. They have been in use now for some time. The diagnostic tests for COVID are several. There's the PCR test, which is the most sensitive and specific. That's the one that uses amplification technologies. It's generally something that you have to wait. I mean, the better part of the story would be if you wait overnight or 2 days. Sometimes there's a delay, but we're doing much, much better. Recently, you may have heard that there have now been 150 million tests of the Binax Abbott test, which is an antigen test, which is used much more for surveillance, such as in nursing homes and in places like that and in schools. So the answer, Eileen, to your question is that yes, there are diagnostic tests for both of these. The issue that you mentioned, is it dangerous to get the wrong diagnosis? It is always dangerous to get the wrong diagnosis. Certainly you want to, and it's really important. And that's one of the reasons why all of us underscore the importance of making sure you can help eliminate at least one of them or mitigate at least one of them by vaccination against influenza. I think that if you give someone Tamiflu thinking that it is influenza when it's the beginning of a COVID type of infection, because you have a person who has an underlying condition, and you know the CDC recommends, and Dan can weigh in on that, that if you have someone who has an underlying condition as an elderly and you strongly suspect they have influenza, that you should start them on an anti-influenza drug and not wait for a period of time for the reasons that we've all underscored, that it is best to get treated within 24 to 48 hours. But you're right, we need to get the right diagnosis and we need to eliminate what we can eliminate.
You know, Eileen, let me just reinforce that this is going to be a diagnostic area of confusion this entire winter season, what with these two viruses and other respiratory viruses that are out there. I wouldn't be surprised that if influenza is present and known to be present extensively in one's community, that doctors may be treating empirically with an anti-flu drug while they get a COVID test and send it off. But the importance of treating quickly against flu to shorten the duration of the infection and to make it less severe is very important. This will be a challenging winter for all of us. Marla?
So the next question comes from Marissa Lati from the Washington Post. The question reads, I believe I heard two different percentages for how many people got the flu vaccine in the 2019-2020 season, 48% and 51.8%. Could you please clarify the difference between those figures?
Dan, would you have that number on the tip of your tongue?
Sure. Yeah, I think there are lots of numbers. This is something that CDC often does. A lot of that information you can drill down on our website. These information will now be available in an interactive tool as well. In general, what we're talking about is among all people, 52% were vaccinated, which is up about 2.6% from the year previously. Among children, 64% were covered, which was up about 1.2%. And among adults was the 48%, which is up around 3%. So that 48% represented those over age 18, 52% represents all ages.
Thank you very much. Marla.
So Bill, the next question is there any difference in timing of flu vaccine this year because of COVID-19? As in, should people have waited until October? Will those who got vaccines in September have issues later in the season? And should people wait even later to get a flu vaccine? What does the CDC recommend?
Well, the CDC certainly recommends getting the vaccine right now. October is the golden month. Let's do that right now. If you happen to let October slip by and you're not vaccinated, but get vaccinated anyway, because influenza usually peaks in this country end of January and into February, so you still have time, but let's not procrastinate. Let's do it now. Get yourself and everyone else in your family vaccinated. There is discussion in the scientific community that particularly in some highly vulnerable groups, older persons whose immune system may not be quite as robust as younger people, and in some people who have chronic illnesses, if you get your influenza vaccine very early, for example, back in August, there is a concern that your protection may not quite extend into February and March. Talk to your doctor about that. There are no formal recommendations for revaccination during the season. So I'll just leave it there. Marla?
Great. So a good follow-on is there are people who may be nervous to go out and get a flu vaccine this year if they've been avoiding the public or indoor spaces around others. So what's your advice to them?
I'm going to ask Pat to get into this. Should people, such as people who have some gray hair, be concerned about going to a healthcare provider to get vaccinated?
Thank you very much for that question, Bill. People, again, should do what they need to do to protect themselves. And definitely if they're going out in the public, they should wear a mask, wash their hands. Definitely if they're coughing, make sure you're using your arm, cough into your sleeve. I would say that older people, you can contact your physician or your healthcare provider, because sometimes the physicians are scheduling times just for the flu vaccination. And you will see that your doctor also is making sure that they are taking precautions and following CDC guidelines to make sure it's a safe environment for you to come into the office and receive medical care and get your flu vaccination. The same thing is going on if you go to a pharmacy or retail pharmacy out in the community. They are taking extra precautions. They are following the CDC guidelines to make sure that any potential exposure is minimal. But I would say if you have a physician, call them ahead of time. I know in children, pediatric offices, we even have where the children will, the parents will come and park the car in the parking lot. The nurses or the physicians or whoever's coming out to give the flu shot will come out to the car. Now, let me caution, because we understand that there's a large population of children whose parents may not have cars and use public transportation. But I can tell you that the health department and the federally qualified health centers are also following those guidelines and making sure they have sessions, perhaps just to give the flu shot, and other sessions, separate sessions to see sick children. So in answer to your question, certainly for people like you and me, yes, it's important to get your flu shot and make sure your facility, your physician's office is following the CDC guidelines and taking precautions, and wear your mask.
And there has to be a little more self-motivation on the part of adults. So many adults have been receiving their medical care during the COVID era via telemedicine. Well, I haven't figured out how to provide an immunization through the computer yet. You really do have to show up and roll up your sleeve. And the other thing is, many of us have been working from home. And so occupationally acquired influenza vaccine, getting vaccine in the workplace, many employers provide that, is not going to be as readily available. So we all as adults will have to be more motivated to get out and get the vaccine. And as Pat says, you can do it in and out very quickly and safely. And yes, it's important to do this. Marla?
So, Bill, before I go on to the next, I just wanted to make an announcement. There have been several questions asking about when the recording will be available because of bandwidth issues, the good news of so many wanting to watch. The answer to the question is the recording will be posted on the NFID website this afternoon.
Bravo.
So the next question is, can we draw any inferences from the recent flu season in the Southern Hemisphere? What are you taking away from the mild severity of the flu season observed there over the last few months? And can we expect similar severity here in the US?
I'll ask Dan to address that.
Yes, sure. So we've worked and recently just published on some information from our collaborators in South Africa, in Australia, in Chile, where they had a number of measures that were put in place, like Dr. Fauci mentioned, with mask wearing, social distancing, shelter in place, et cetera. All of those efforts really saw a dramatic drop in COVID, but also especially in flu. In the United States, in April, March, when we started implementing a lot of our same measures, we saw those same cases of influenza decrease. Even though we were testing for flu, we saw the numbers of cases decrease. And that's just because the right effort, the right kind of environment for transmission of flu is just not there. As we go into this flu season and into the fall and winter, people are not going to be able to eat outside. They have to eat inside of restaurants. They're going to be spending more time inside. People are probably going to be going back to work more than they were previously. And schools are opening up. We know that influenza really likes school children. They like the university students, and those are settings where a transmission can occur with flu. So if those kinds of transmissions are happening or those opportunities occur, both COVID and flu can take off. So we don't know exactly what will happen. I don't think we can rely on this significant decrease that we saw in the Southern Hemisphere, because I think we will be seeing some lessening of some of those restrictions in the United States. So we just have to be on guard. Take flu out of the equation this year by getting vaccinated.
Absolutely. Let's get vaccinated. Federico, I want to give you the opportunity to say once again something that people who are watching and listening may not have heard impressively enough. We've been saying this for the last couple of seasons, that the inflammatory response associated with the body's fighting flu actually sets you up for an increased risk of heart attack and strokes. So if you get vaccinated, you actually diminish your risk for heart attacks and strokes. Say it again.
Yeah, that is very true, Bill, and thank you for stating that for me. You're absolutely right. Indeed, the risk of having a heart attack a few days after, within 7 days of having contracted the flu, goes up by 6 times. That is a lot. So if you think that by having the flu in a population that by definition is already a higher risk, not only higher risk for getting the disease, but higher risk for having complications from the disease, then we understand how the cardiovascular disease, heart attacks, heart failure, arrhythmias, myocarditis, all these things are more likely to happen in the setting of a patient that has had the flu than patients that did not. So protect yourself, prevent it, don't wait for the Tamiflu, take your vaccine and do all the measurements so you do not need to take the Tamiflu and you do not need to deal with all the cardiac and stroke complications.
Thank you. Marla, I think we have time for one more.
So, Bill, we have many more, and I think we don't have time, unfortunately, but we will follow up directly with those reporters whose questions have not yet been addressed. I think, unfortunately, we need to wrap this at 10:30. So I'll turn it back to you, and thank you all for your time.
Thank you. Tony, 30 seconds, your last message.
Yeah, we cannot emphasize any more strongly the importance of what we're saying today about the benefits of influenza vaccine in general, even if we were not in the middle of a COVID challenge. Influenza vaccinations are important to prevent infection and to modify infection when you get it. The things that we were talking about now, it is a serious disease. It is not trivial. You saw the slide I put up with the deaths and hospitalization. You superimpose that upon the challenge that we inevitably will face with COVID as we get into the fall and winter and go more indoors, which will be challenging for the prevention of a respiratory infection. So let's do what we can with the tools that we have. And we have a good tool in an influenza vaccine. Thanks, Bill.
Thank you all. This news conference is sponsored by NFID in collaboration with the CDC, and special thanks to all of our partners and the funders who make this activity possible, including AstraZeneca, Genentech, GSK, Merck, Sanofi Pasteur, and Securus. NFID policies prohibit funders from controlling program content. A video of today's news conference will be available on the NFID website at www.nfid.org. Once again, thank you all for all you do to get the word out about these important public health messages. We wish you all the best. Please stay safe. And of course, get vaccinated against flu. Thank you, everyone.